Good morning, everybody. This is Dr. James Lin. Welcome to my channel again. Today I will continue with my life story as a chiropractic physician. Okay, so continue from the last story. You know how I was, high school. Eventually came to chiropractic school, and then got my license. So anyways, I'm gonna continue from that point on. If you're interested to hear my story, go and continue. If not, that's fine. You can see another episode. But be sure to press the like button and subscribe to my channel for more information to come. So when I graduate from my chiropractic college or university, I got a job in China. That was back in 2000. Yeah, year 2000. I'm like super excited. I'm like, I want to go to China because I'd never ever been to China before. I've heard so much great story, and I love Chinese culture and Chinese traditions, and I like Chinese people. I'm Chinese, but obviously, so I found a job, in an ad saying they need somebody, a doctor in China, so I went there. At that time, I just graduated. I did not have my license yet, but in China, you don't need a license. As long as you graduate, you're fine. So I went to Beijing, and I spent 6 months in Beijing. I went to the Beijing hospital. I work in the private clinic. I see hundreds and thousands of patients over there. Mind you, I just graduated. My technique is horrible. So I was there. Doctor told me to use his technique, which I never learned before, and start seeing patient, and I got the most horrible result. Patient gets worse, patient have pain. After a few weeks, I'm like, that's it. I can't use this anymore. I cannot get patient worse anymore. Even though I'm from America, the doctor told everybody I am the American doctor, and everybody's like, wow, he's American, he's from the United States, he's wonderful, and all that. People pay more money to see me, but they get worse. I cannot get through that. I cannot get myself to treat patient that way. So I revert back to my old technique that I learned in school while in the clinic, while in the internship. And then I start seeing, changes. People people getting worse, they started getting better. And better and better and better. And I'm happy, so I'm content. At the same time, I visit a lot of places in in Beijing. See the palace, see the Great Wall of China. That was fun. That was just a trip. The best time of my life. And I also, I become friends with their doctors, with the nurses. Just whole gangs of friends where we go out and have fun. We visit Shanghai, Hangzhou, and I am just having a blast. I loved every minute of it. And then after, maybe 5-6 months, I need to come back to get my license. So, of course, the doctor, my boss in China, in Beijing, he wanted me to stay because I can speak the language, and I help him, train those other doctors on how to do chiropractic stuff. But I had to come back to get my license. So he urged me to stay, and I said, I will if you increase my salary. He doesn't want to, and so I'm back. So I'm back for good. Okay, so I came back to the United States. After got my license done, and after I got my license, I went to my friend's clinic. He has a clinic in Artesia, and I worked for him. Basic salary, $10 an hour. I worked there to help him set up the office, the front office, set up the billing, how to help him set up, how to run the patient procedure. Of course, I didn't know those before. I had to study and help him at the same time, sort of study to know how to use, computer software, how to run patient, how to organized clinic. So I did that for him. I did that for about a year in Atisha. It was fun. Yeah, we hang out. We go out. Sometimes we eat stuff. We go to friends' party and stuff like that. It was really fun with him. So that was another blast in my life. And then I found another, and then by the time I was done with his place, I found another place in Pasadena. Why? Because my friend in Artesia, he just paid me $10 in an hour. And on top of that, I had to clean his restroom too. I mean, it is all practice. So now thinking back, that is actually great practice, because on my own clinic, I have all the basic knowledge back then when I was helping him setting up his front office stuff. So I can bring my knowledge back to my own clinic to set up my own front and back office. Anyway, so I found another job in in Pasadena. Dr. Collins, he's a great chiropractor. Really horrible temper. I mean, the worst part of him is a temper. Everything else is actually pretty good. Okay. So he gave me, $3,000 a month. So I work with him. So I treat about 40 to 50 patients per day in his clinic. And I treat and I learn, I treat and I learn. I just keep learning. And then eventually, I started to go out and socialize and go into maybe Lions Club, to Chamber of Commerce, to sort of kind of passing on my card. And at the same time, on the weekends, my other friend, he has a room that he said he could rent me if I come out in Pasadena. But on the weekends, on Saturday and Sunday, I could use his place for free. So during the weekends, I see some of my other patients, which I got in going out social at church or social functions, and then slowly over about 2.5 years, working in Pasadena, and I think it's about time for me to come out. So I quit the job. I came to Arcadia, which is my friend's clinic, and I pay $500 a month to use one of his room, and I start going out even more. Lunchtime, I would go to different social function. At night, I would go to different parties just to pass out cards, just to get to know people. I also do a lot of presentations, a lot of talk in Lions, Service Club, a lot of different places I do presentation. And every time I do some presentation, I give few patients, insurance patients, cash patients, I give few of that. Eventually, after a few months of just doing that, I started getting more and more patients, because that's free advertising basically. You don't have to pay money. The only money that I have to pay for is the membership fee and the food, of course, and my time. So at that time, I think it was 2005 or 4, because I'm eating outside all day, like really all day. I become so fat. I think the worst weight, I was like 180 pounds. If you see my weight loss video, you'll see how big I was back then. So anyway, that's another story. So after that, patients started coming, and my patient base exceeded my friend's patient base in Arcadia. Mind you that he has $1,000 square feet clinic. It's not too big. So I have more and more patients coming in. He, on the other hand, is steady. Not a lot. So he's not too happy. Why? Because I only pay him $500 a month. And keep coming in, patient keep coming in. So one day, he faced me and just said, it's about time for you to come out, to go out. So I'm going to kick you out. So, and I start looking for places, and I found here, which is San Gabriel, 397 West Las Tunas Drive, San Gabriel. And I started that 2006 till now, 2019. So, gosh, 13 years. Okay. So, it's been a trip. It's been fun. So I'm kind of glad he kicked me out, though. At the beginning, I wasn't too happy. I mean, I'm like, why did he kick me out? I mean, you know, I'm just not too happy. But I'm glad he did, because that kind of forces me to have my own location, to have my own practice. Because by the time I finished Acadia, I moved to San Gabriel. I lost almost all the patient in Acadia, because knowing that if you know in a business, if you move to another location, you're gonna lose your client. I mean, there are going to be some client that's faithful to you, but you're gonna lose majority of the clients once you move. So because of that lessons, I know how important it is to stay where you are in your business, to stay put, and to just build patient. Just build and build and build. So here I am. When I just moved here, I have very little patient. Of course, by the time I was here in this clinic, it was just, half. Just about 1,200 square feet was just half. But I keep doing the same thing. Keep going out, keep getting more and more patient, And to the point that my patient base is enough to start generating by itself. So I don't have to do any more advertising. So right now, I don't do any advertising. I only do Yellow Pages. And most of my patient base are now word of mouth. And the patient base that I have now, it's enough to cover all my bases and my expenses. So that's my story till now. I'm glad I can help to share with you, and so that you would know me better. So when you come and visit me, if you come visit me, you know who I am, on a more personal basis. All right, so I'm just happy that I can share that with you. Now make sure to press the like button and subscribe to my channel. And I will see you next time.